such that your body is reacting against those allergens. The allergen can be either, it can be from pets, it can be the hairs of pets, it can be drugs. Particularly drugs like penicillins are capable of causing allergens. We have also fluoroquinolones. Is it clear? So certain people are allergic, particularly in penicillins. Is it clear? Or you have also protein containing drug products like insulin, you can be allergic to it. Is it clear? So particularly the insulin that is produced from the markets, the synthetic ones. Is it clear? So you have those type of allergens. Now, the next one that we have allergen, or in cases of drugs also, we have also antivenoms, is it clear? So, immunoglobulins that you can be allergic to that. Now, the next allergen, we have food drugs, or we have even food, particularly nuts, is capable of causing allergies, is it clear? So, when the patient is going to be exposed to this allergy, you first have a primary contact. In a case of a primary contact, what happens is that the body, the B cells are going to respond. They're not going to, the patient is not going to manifest the allergic reaction in the primary contact. So in the primary contact, what happens is that you're going to have an autoimmune response where the B cells are going to produce the immunoglobulins E. Is it clear? And the immunoglobulins E are going to bind to the mast cells. Is it clear? The mast cells are some forms of basophils. Is it clear? When they bind now to the mast cells or the basophils, is it clear? Now, when there is another contact, which is called a secondary contact to the allergen, is it clear? When there's a secondary contact to the allergen, what happens is that the B cells, the basophils, or the mast cells which contain the immunoglobulin E that is specific to that particular allergen are now going to respond to that. And the method of response is by the release of histamines. Is it clear? So the first one is that it can respond by releasing histamines, and if it only releases histamine, it's going to be presented by pruritus, meaning that the patient is just going to scratch his body. Is it clear? The second one is that it can also manifest by the release of prostaglandins. So the basophils can also release the prostaglandins and the leukotrienes. So in this case, it's going to manifest with signs of edema. So we have angioedema of the face, and all that. Is it clear? And lastly, when this is going to be the end point of that angioedema, is going to result to shock, which is called an anaphylactic shock. That is what we are always afraid when we are going to have a type 1 hypersensitivity reaction. So now, after having the type 1 hypersensitivity reaction, the next type of hypersensitivity reaction that can still occur in the case of infection or exposure to a particular protein, a particular antigen, is that you can have a type 2 hypersensitivity reaction. A type 2 hypersensitivity reaction is going to be mediated by antibodies only. Is it clear? Meaning that what? A type 2 hypersensitivity reaction particularly occur when you have a streptococcal infection, when you have a streptococcal infection in patients who are prone to have the disease. Is it clear? So when you have streptococcal infection actually is going to result to antibodies production. Is it clear? Now the antibodies production are going to target the streptococcal, the group B hemolytic streptococcus microorganism. Is group A particularly, sorry. So it's going to target the group, generally the microorganism at the group A beta hemolytic streptococcus. Example, we have streptococcus pyogenes. Is it clear? So normally it's supposed to target, the antibody is supposed to target it, but now in certain patients, that is 5% of the population, so certain people are going to have cross match of the antibodies. Is it clear? And when they have the cross match of the antibodies should not normally supposed to target the streptococcal infection, instead target their own connective tissue, or it targets their own kidney. Is it clear? When it's targeting the connective tissue, it's going to result to what is called rheumatic fever. Is it clear? And when it targets its own kidney, it's going to result to what is called post-streptococcal glomerulonephritis. Post-streptococcal glomerulonephritis. Is it clear? And this post-streptococcal glomerulonephritis presents with a nephritic syndrome. And if you want to know the nephritic syndrome, go on a tutorial of acute and chronic renal failure. For the rheumatic fever, you're going to see that in a later tutorial. Is it clear? So that one is in the case of a type 2 hypersensitivity reaction, which is going to be mediated by antibodies. So here you are going to have an infection like streptococcal infection is going to result to this antibodies production and all that, which is going to, as you can see. Is it clear? Now, the next other problem that you can have in the case of infection is the case of a type 3 hypersensitivity reaction. Is it clear? A type 3 hypersensitivity reaction is going to occur in the case of an antibody antigen mediated. It is antigen antibody mediated. Is it clear? So peculiarly, we have certain infections which are going to have which is going to result to this type 3 hypersensitivity reaction, particularly in the case of hepatitis B or hepatitis C viruses. Is it clear? So in hepatitis B and hepatitis C viruses, you can have antigen antibody mediated reaction whereby this antigen antibody are going to damage the kidney, the glomerulus of the kidney. Is it clear? They're going to damage the glomerulus of the kidney. And in the case of hepatitis B, you're going to have a membranous nephropathy. Is it clear? You're going to have a membranous nephropathy. And in the case of hepatitis C, you're going to have a membranoproliferative nephropathy.